egg of parasites. 4 images were given in today's exam, and they asked to identify the eggs, individual eggs for 4 images. So let's identify the eggs one by one. First one, so which is the first one? This is nothing but Ascaris. So this is egg of Ascaris. So number 1 is Ascaris. Second one, this is the egg of Hucom. So this is egg of Hucom. Third one, this is the egg of Tinea solium. And the fourth one, this is the egg of H. nana, Hymenopsis nana. So this is the identification of eggs. So this question was given in today's exam. So they have asked to identify the individual eggs. The options were like egg 1 Ascaris, 2 Hucom, 3 Tinea, 4 Hymenopsis nana. Alternative options are also given like 1 Hucom, 2 Solium, 3 nana, 4 Ascaris, like that. So the answer will be this. This is Ascaris, this is Hucom egg, this is Tinea, and this is Hymenopsis nana. Coming to the question number 2, this was very easy question. One hand deformity image was given like this, and they have asked to what is the mechanism behind this deformity, or what is the nerve that is damaged. So as you can see, this is nothing but partial claw hand. This is partial claw hand with clawing of 4th and 5th fingers. See, there is flexion of proximal and distal interphalangeal joint along with extension of the metacarpophalangeal joint of 4th and 5th disease. So this is partial claw hand. This occurs because of damage of nothing but ulnar nerve. So the answer is ulnar nerve. So ulnar nerve damage causes partial clawing of 4th and 5th disease. Alternatively, for 2nd and 3rd disease, median nerve damage causes 2nd and 3rd digit clawing, and ulnar and median together, these two nerve together damage causes total claw hand. Next, coming to the question number 3. Question number 3 was with this image. The image was something like that. The question was like, following prick injury, a patient develops following skin changes along the lymphatics. So following skin changes along the lymphatics. So what is the reason for these skin changes? So as you all know, this is very popular image for competitive exam. This is nothing but, as you all know, also known as Rose-Gardner disease. Rose-Gardner disease. I think the answer is known to you. What is the other name of Rose-Gardner disease? The disease is nothing but, the answer is sporotrichosis. So sporotrichosis is the answer for this question. This is nothing but Rose-Gardner disease or Rose thorn prick disease, also called Rose Handler disease, caused by fungus Sporothrix schenki. So caused by fungus Sporothrix schenki. So this is the answer for this question. Next, question number 4. This is one image of obstetrical instrument, obstetrics and gynecological instrument. This is nothing but Cascos speculum. So this is Cascos speculum. The full name is Cascos self-retaining, Cascos double-bladed. This is self-retaining vaginal speculum. So this is Cascos double-bladed self-retaining vaginal speculum. And other 3 options are like, one among them was, I think, Sims speculum, and I forgot rest 2 of the options. So coming to the next question, that is question number 5. The question was about RTA patient. The question was clinical. very long question was there. The question was like, one RTA patient came to emergency with shock, like BP was less like 90/60, or heart rate was more like 120 or 110 beats per minute, and the patient was in shock. The VS or visiting surgeon asked the intern to infuse intravenous fluid as early as possible. So with this color, intravenous cannula, this is green color, and the question asked is, what is the flow rate for this cannula? So the options were like, I forgot the exact options, but I think the options were like 66 ml per minute, 86, 96 or 106 ml per minute. I think the options are like that, but according to the standard textbook, the green gelco flow rate is 90 ml per minute according to many standard textbook. So I don't know what is the actual answer for this question, either 86 or 96. 86 is the nearest to 90 ml per minute, so I think this is the probable answer, 86 ml per minute. Next question is question number 6. What is the best method to measure HbA1c? This is repeat question from M's previous paper, and this question was also asked, I think, in the previous INICET, I think INICET November, INICET November, sorry, INICET July session. This question was also asked in INICET July session. Same question. The question was repeated again. So this is nothing but ion exchange chromatography. This is the right answer. This ion exchange chromatography is the best method to measure HbA1c or glycosylated hemoglobin. Next, what is the mechanism of action of this drug remdesivir? So this is very popular drug for this COVID era. So what is the mechanism? This drug inhibits which enzyme? Is it RNA dependent RNA polymerase or DNA dependent RNA polymerase or DNA dependent DNA polymerase? Which is the actual answer for this question? This remdesivir inhibits RNA dependent RNA polymerase enzyme. So this inhibits RNA dependent RNA polymerase enzyme. So this is the answer for this question. Next one liner question was there. The topic was hepatitis B or Hep B vaccine. Hep B subunit vaccine is derived from which antigen? The options were like HBe antigen, HBs antigen, HBc antigen, or hepatitis B DNA. Something like that. I forgot the actually fourth option, but these three options were there. But for this question, the answer will be hepatitis B S antigen or surface antigen. So hepatitis B subunit vaccine is derived from surface antigen or HBs antigen. Next, this was clinical question, very long question, clinical scenario based question. The question was like that: one patient, I think near about 50 to 60 or 40 to 50 years old, sorry, not 50, near about 30 years old, one patient complaining of abdominal pain for 3 days, obstipation for 2 days, and nausea and vomiting, and the patient had developed severe pain today, and abdomen is rigid. On X-ray you have find this, on straight X-ray abdomen or chest X-ray, this is the result. So what is the diagnosis? So what is the diagnosis? This is also repeat question from M's previous year questions. So this is nothing but pneumoperitoneum. But in this session, pneumoperitoneum option was not there. The examiner has twisted the options. So in place of pneumoperitoneum, the option was hollow viscous perforation. So the answer will be hollow viscous perforation. which cause pneumoperitoneum. So this X-rays is suggestive of pneumoperitoneum, hollow viscous perforation. Question number 10, double bleb sign. So double bleb sign in USG is indicative of. So the options are like amnion and chorion, amnion, chorion, then amnion and yolk sac, then primary, secondary yolk sac, and like that. So I don't know the what was the, I forgot the rest two options, but in this case the answer will be amnion or yolk sac is seen as double bleb sign and USG. See the USG, this is the USG of double bleb sign. You can see the two blebs here. Here is one bleb and here is another. This two bleb is called double bleb sign. One is, this is amnion and this is yolk sac. So this is double bleb sign in USG, one of the earliest features of sonological features. So I have discussed first 1 to 10th question of today's